go, 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 go. Go, go. Go, 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 go. Go.
My name is Kyle, and I've been diagnosed with paranoid schizophrenia. I have people inside my head. I hear voices, and they make me see stuff. Usually there's around 3 people in my head. They're not good people. They all have their own personality, their own voice. There's no right to reasoning with them. They talk to me all the time. I can wake up in the middle of the night and they're right there. I don't know what they're doing or what their objectives or agenda is. It's always bad, always threatening. I hear them in my kids, I hear them in the TV, I hear them through other people. So I try to do what I can, I guess. There's nothing that I can do. It'll go like that day after day after day, and I go into a psychosis and there's nothing that I can do. You know, there's nothing anybody can do. It's like your whole body gets put into shock. It causes uncontrollable muscle movements, you know, kind of like restless leg syndrome or head twitching. I pace around, but I don't eat, I can't sleep. I'm worried, I'm in fear for my family. Sometimes when they do visuals or talking, you go cross-eyed or it goes blank, and then you know, like I'll be driving a car and I'll go to a stop sign and they'll say go. Well, in your brain, your body is saying go, so you start to go, but you know you're trying to stop. And they do stuff like that. They diagnosed me with paranoid schizophrenia, but I believe it's something called Psychotronics Anonymous, and that is artificial telepathy. There's doctors that have developed it 10 years ago to where they can do brain-to-brain communication, and I don't know what kind of technology it is now, but I know it's out there, and I know at the start of it, you know, that it's real, and there's no way to stop it. I hope that, you know, that what Psychotronics, what I'm talking about, that there's light shed on it. It's all too real to be just in my head. I've been taking many different medications. I'm on my 5th different medication, clozapine, and it can actually change your blood cells. So I have to have my blood taken every week, and it don't work either. Nothing. No medication, no, not anything has been able to get a handle on this. I don't know how it started. I wasn't able to recognize it at first, but I guess it's been going on for 3 years. I've been to halfway houses, I've been to behavioral health centers, and I find being around people helps a lot. So I try to stay around as many people as possible. I had several jobs since I left. I had a job that I worked for in processing since I was 16 until I was 29, and ever since I got sick, you know, I've had like 4 or 5 jobs, but I'm not able to hold them. I'm not able to concentrate. My kids and my ex is very understanding. My kids are very supportive. You know, if I get distracted and, you know, I'm in my head, they'll pull me out of it. And, you know, they tell me to take my medicine and go eat, and, you know, they're very supportive, very loving. You know, I'm lucky. I hope it stops. I hope I can get back to work, you know. I'll take care of my family like I haven't been able to do. I guess I just want to live a normal life and watch my kids grow up like everyone else.
As a grandmother, I just want my grandkids to be happy and satisfied in life. And when I see that that's a huge challenge and it's not being overcome, I just feel helpless. I wish I knew what to do. He's always said the medication doesn't work because he continuously hears the voices. And for me, I just feel so helpless. I just wish they found a cure. I just wish there was something to cure Kyle and become the joyful, happy young man he used to be.
Schizophrenia is a mental health condition that's defined by about 3 categories of symptoms. One is a positive category, which is a little misleading because it actually means symptoms in excess of normal functioning. So that's where we see psychosis, which is hallucinations or delusions. Hallucinations are disorders of sensation, so that's where people will see things that aren't there, hear voices. More rare is tactile, where people feel certain things on their body. Delusions are disorders of belief, where they may see the same thing that you and I see, but they may attribute a belief to it that's different. So a car driving by is, the FBI is out to get the person. So those are 2 characteristics of the positive symptoms. Then we have what are the negative symptoms. Negative symptoms are basically a reduction of normal functioning. So problems with motivation, flat affect, so their mood will feel really down. Initiation and motivation is impaired. And so those are the negative symptoms. And then there can be some cognitive symptoms where it's a sense of cognitive disorganization, executive functioning, kind of planning and sequencing is sometimes impaired. So it's usually a mix of those 3 types of symptoms. And it's usually a chronic condition, but also in terms of prevalence, a little more rare than some of the other disorders that we see. So I think it's about between 0.3 and 0.7% of the population will have it. Schizophrenia is usually diagnosed and starts to emerge in late adolescence, early adulthood. It's extremely rare that anything after like age 45, but mostly I think what we see is between 18 to 20 is where we see it first emerge and be diagnosed. But of course, probably anything before 45. So it's usually, some of the thinking is that there are some kind of vulnerabilities that are even maybe present in a prenatal developmental process that gets exacerbated, or exacerbated, I should say, with puberty. And so that's why we're seeing around 18 to 20 that it first emerges. So I think that there's 3 classes of treatment to think about. One, of course, is medications, and generally speaking, we think of that as a first line. Not being a prescriber, I'm not really qualified to speak in depth about it, but in general, I think that has generally gotten a little bit better as time has progressed. And that may help to manage some of the symptoms, like the hallucinations, delusions, and the mood and affect symptoms we'll see. And there's also, secondly, psychotherapy. There's some research that cognitive behavioral therapy has been effective with treating psychosis particularly. And in that case, I think the objective really is to help a person learn to relate to those experiences differently. So rather than being really terrified and feeling that those experiences are real, they start to learn that is part of the disorder, and to try to filter out what's real, what's a symptom. And then thirdly, I think, which is probably pretty important too, is kind of psychosocial community support types of interventions. So again, when we see the disorder begin, it's around 18 to 20. And that's the time where people are either going to school or they're starting a career. And there's a lot of skills that are, you need to learn around that time period. And so if there's, like job counseling, job support, those services might help an individual learn how to get by in a work environment when, normally an individual is kind of learning through their experiences through school or work how to develop those skills. Those have to be put on the back burner while they learn how to manage their symptoms. And so ultimately, some support in that direction I think can be pretty helpful. the challenge is always just making headway on the ability to function. Can they work, have relationships, and learn the skills that they need to do that? So I think that there is a lot of hope out there. I think the challenge, though, that we see in the mental health field is that the treatment process is it happens in a social context, and there's a lot of variables that come with that. There can be differences that from one provider to the next, that's just interpersonal variations, that it's easier to bond with one clinician versus another. And I can be great with one individual and we do great work, and somebody else with the same condition, the interpersonal mix is just different, and it's a little less successful. So my encouragement always is to have people keep trying, keep looking to make a connection with a provider. And I think about the first visit as, yes, as a provider, it's my chance to get to know what's going on for the patient, but I also think it's the patient's chance to get to know me as a provider. And so I think it's important that now I would empower patients to really interview back their providers to make sure that they feel like there's a good fit. We know that in the mental health field that the therapeutic relationship accounts for more sometimes, this is especially true in counseling, but accounts for more than any specific technique or type of therapy. And so a strong relationship can be more predictive of success than sometimes medications and sometimes the type of therapy used. So I really encourage people to find the right relationship in their provider, and that's going to be more of a sign of possibilities and improvement. So in terms of being a supportive family member, I think that what's important is to think about a couple of things. One, it is possible, so I want to be mindful in educating that it is possible that, say hallucinations and delusions, they can have, a scary content to them, and they can be suggestive of harm to either that person themselves or others. In those cases, certainly I would encourage to be proactive. If it does feel like people are at risk of harm, 911, calling police if needed. But there's a whole, excuse me, there's a whole range of symptoms that may not necessarily be scary. But I think that what's true for family members is that since it seems so scary because it's the person's hearing voices, family members get a little rattled as well. And so I think it's important to simply model that the experiences that the person might be having is okay, isn't necessarily scary, and not to try to fight or invalidate those experiences, but certainly encourage that person to follow up with treatment. It can be a rocky process. It isn't something where, you might find the right provider right away, or you find the right medication right away. You may need to trial a few rounds. And so as family members, helping to support that individual to stay engaged in their treatment is going to be really important. I think that that's really important for me, because you can only have so much time in an hour visit or the first visit. It takes a while to kind of get on the right track. The other thing that I think has made a huge difference for me in understanding how to sit with an individual who may be experiencing the symptoms of schizophrenia is that if we understand the neurocognitive models, the problem isn't so much that the person's hearing voices, because the reality is that we all hear voices. We just normally realize that it's our own voice. The problem that we would see neurocognitively is that a person can't recognize that it is, their own internal dialogue. Lots of times when anybody feels like they messed up or did poorly at something, they'll say some mean things to them. In fact, part of depression is a lot of self-critical thoughts. And so if we think about it, that it isn't that it's a voice coming from somewhere out there, it's sometimes the internal thoughts that are occurring, then our challenge is to help model a new relationship to those thoughts, whether we believe them or not. To practice a little bit more self-compassion. And so I think the challenge as people being supportive is to help model that. I'm not scared off by some of these thoughts or these voices per se. We can have some space to acknowledge them, be compassionate towards that experience, but not really be scared away. Stigma, I think, is a thing that really complicates a person's ability to pursue treatment, but then also how they think about themselves. And so something that, if we are able to be more accepting and allowing that moment to just be here now, I think it communicates a lot to the person struggling with it that things will be okay. And so I think just being able to be supportive of the experience and not invalidating and not stigmatizing, I think that can go a long way. So I think in general, when it comes to supporting people with mental illness, I think a lot can be helpful with being a warm presence towards others. And I think a lot about a quote by Maya Angelou, who said that, people don't remember what you said to them, people won't remember, how you acted towards them, but they remember how you made them feel. And I think to a large extent, being a warm presence, being supportive, being caring goes a long way to helping people get through hard times and have hope and cope with their mental illness more effectively.